Today we're going to demonstrate the modified Mayo protocol. I know many of you have had issues with Mayo pellets, the size of the pellets, the bulk of the pellets, the scar tissue, the ensuing scar tissue, the issues that men oftentimes have. This was a real problem for me with the traditional pellets, and so I kind of devised this way of using smaller pellets, and the problem with using smaller pellets with the regular dosing site is that the surface area is far too great on the smaller pellets when you compare dose to dose. So I simply calculated the surface area of one 200 milligram pellet versus two 100 milligram pellets, and it turns out it's about 40% more. So I reduced the dose down by about 40%. So we get 60% of the calculated dose. And then I'm just going to make a little mark where I'm going to put my anesthetic. So just some alcohol swabs. I do my wheel a little bit differently as well. And you'll notice I'm up and over a little bit more, especially for very thin guys. They have a little bit of a fat pad right in this area. And that's where I like to target. And it's away from their wallet, away from vital structures like that. And I find that they really like it much better. So when I do my wheel, I use a 30 gauge syringe. I just go straight in. Less nerves involved, and I inject a little bit as I come out. And then when I get close to the surface, that's when I get my wheel. Because by then, they've got a little bit of anesthetic effect, because it's really that separation of the dermis from the epidermis that creates that pain that they get, that burning sensation. So I like to make three little marks so I can keep my pellets in line with my anesthetic. And then Makara's getting my anesthetic ready. And then I like to have my numbers up so I can see how much I have delivered into each tract. Because you don't want to get to your third tract and have like 1 cc of anesthesia left. They don't appreciate it too much. And you can sometimes tell when you're hitting a little bit of scar tissue from previous pellets because it's a little harder to inject the anesthetic. Put that in Sharps container. And then I like to do you can see I'm doing everything kind of non-sterile right now. And I like to do this for a couple of reasons. One is that by doing my prep afterwards, I'm helping disperse that anesthetic. And then the other part of that is patients don't need more anesthetic, they need more time. So I'm utilizing that time to our advantage to allow that anesthetic to work. No sense in putting all the anesthetic in and then not having it work for you. And we like to get these people clean. Now, a lot of people don't use a drape, but as a surgeon, I like to create a sterile field. So I start with my gloves down here. The inside of these gloves are sterile. So I create a table using this. I do recommend this because if you have a pellet fall, it falls right onto your sterile table. I like to use a fenestrated drape as well. And again, this is purely optional. This is just what I term a Watsonism, just like that anesthetic, that initial wheel. But now I've got this sterile field where if I do drop anything, most likely it's going to drop onto my sterile field. And I had to give up obstetrics because I was dropping too many things. Just kidding, of course. So I want to build my trocar before we make an incision. I see a lot of people make an incision, starts to bleed, and they just sit there and hold it and dab it. What's going to stop that bleeding is putting the trocar in. And again, since we're using a female trocar, it's a female incision. It's a much smaller incision, much smaller pellets, much smaller scar tissue, and much better tolerated. You'll notice I'm trying to keep my trocar in a perfectly straight line. I think that's real important. Then rotate your basket up to 12 o'clock. And I put my finger over the end of that so it doesn't drop out. And then the technique is relatively the same. Now, I don't like to take that trocar out. I like to remain efficient. I don't set anything down. I want to have this go quickly, easily. And no one likes a whole lot of noise back here that you can get with dropping things into that metal container. And again, you can see I keep my little finger over there to keep pellet from backing out on me. But you can see, you know, I had issues putting that anesthetic in because of a little bit of scar tissue there. And you can see how these smaller pellets just glide right in. Now in his case, because of his dosing, I'm going to do 4-3-4. You can do it however you wish to do it. And if you have somebody that has a dose of 1,300 or something where they're going to need more than 4 pellets in a track, it's easy to slide a 5th pellet in that track. They just slide right next to each other. So you can do a dose of 1,500 if you need to. I've got a couple of gentlemen that are that high. So you can see I'm just about done, and you can see how those slide in. I like to support that where that trocar is, and you can see a small incision, and I like to apply a lot of pressure. And then that's when I tell them their 7-day rules, which hopefully everybody is well adapted to. Keep the dressing on for 7 days, showers only for 7 days, no baths, hot tubs, swimming pools, no lower body workouts. The walking is fine. I do recommend a lot of ice for the first 24 to 48 hours. And by the way, I think this pressure is probably one of the most important things that we can do with our pellet patients. It reduces bruising, reduces seromas, reduces other complications. And so just a little bit of pressure. It actually takes about 7 minutes of pressure to occlude venous bleeding. And most of the bleeding you're going to occur is going to be venous. You don't have to hold it for 7 minutes, but if you have someone who's on a blood thinner or low platelet count or something like that, you may need to do that. And you can see it's a nice small incision. I do not use benzoin on these because I do see reactions between the adhesive and the benzoin. And you can see how I pulled from one side that way and then this side this way, keeps those edges approximated. And then again, some pressure. And then we have these very nice, generous ice packs. There's 2 sides. There's a blue side and a white side. White side has cloth on it, and that's the side we want up against the skin. And again, we want to place that where the pellets are. So, and that is the modified Mayo procedure.